Welcome to the first Spring into Risk Management webcast. It's March 19th, 2018, and it's Zoe Brooks speaking. This is webcast number 1 with an overview of the project. We're going to talk about what, why, who, when, where, and how. I want to do this rather quickly. We're going to do this in a series of small webinars. So what is this project? It is a collaborative project where people work together for the specific purpose of raising the level of medical lab quality. We're going to examine glucose, calcium, sodium, and extrapolate what would happen beyond that. Can we, in fact, grow more quality simply by managing quality differently? Why? Why am I trying to do this? I ask myself that almost every day. Because I am convinced that many/most labs allow higher error limits and higher failure rates than are either medically allowable or generally attainable, and that we can do better. And if we can do better, we should do better. Secondly, many statistical quality control processes fail. They don't do what they're supposed to do. They don't protect patients from the risk of lab errors. So we're going to measure the actual risk of lab errors. We're going to say, can we improve quality? Can we reduce cost? Can we raise the quality of medical lab results? Because healthcare quality and patient lives improve if we raise the level of medical lab quality. The next question is, who is doing this project? Well, you, me, and M.O.R.E, your M.O.R.E quality consultant. You're you, I'm me. M.O.R.E is our robot who is the representation of this early stage of automated risk management. She does the statistics. She is a M.O.R.E quality consultant, and M.O.R.E stands for the process of mathematically optimized risk evaluation. So we have software that can crunch existing statistics into risk management risk metrics. It's sponsored by myself simply because I care about this. I am Zoe Brooks, Zoe Brooks Quality Consulting. I am a person who has spent my life trying to improve quality of lab medicine because I believe this can and should be done. This project is sponsored by Awesome Numbers. Awesome Numbers is the company that created the software that's called Catalyst QC that powers M.O.R.E to create risk metrics. The idea is that Awesome Numbers will then provide this software as a widget to anybody who wants to properly manage risk in medical labs. It's going to take place at Awesome U, which is an online community that Awesome Numbers and I are trying to create if you want to participate. The participants are divided into 4 categories. There are participants, these are labs who actually send risk drivers. There are analysts, people like myself who are fascinated by the numbers, Six Sigma black belts, PhDs, lab directors, people who care what is the truth within these numbers. Then there are panelists, loudmouths and writers. We like to talk, we like to speak, we are determined to make a difference. And there are the attendees, the people who say, I'll start here. After you guys have done all this hard work, you prove to me that there is a benefit to this, and I will consider changing. And if we do that, then patients and healthcare will benefit from raised levels of medical lab quality. When? Well, that's simple. Participants send risk drivers from the end of March, so we're going to collect data from the end of March, send it in April. Analysts are going to crunch that data in April, but we're going to start practicing in March. Panelists will write and speak. We're going to do a webinar and have a book ready to launch in mid-May, and that's when the attendees show up. And after that, patients and healthcare benefit forever. If we're right, if we can prove we're right in the next 2 months, we can do something to improve healthcare. Where? Well, in the cloud, of course. Where else would it be? And everybody, everywhere, can benefit. How? Well, participants send risk drivers. Analysts use the new software to measure existing error rates and compare the effectiveness of various statistical processes to detect simulated method failure. Then panelists evaluate and present results with recommendations, and attendees learn, change practice, and save based on best practice and evidence. So we're going to compare what people actually do to published best practice. It starts with participants. If nobody cares enough to send data, we'll never be able to prove what we can do. So it all starts with you. You need to send us information telling where you are, where you want to be, and where you expect to be. That's the mean, the standard deviation, the number of data points, the true value, the package insert or peer value, your quality goal or TEA limit, your QC chart values and rules, and the number of patients tested in the month of March. That's not hard to do. So where do we go to from here? Well, that's really up to you. If you want to participate, if you want to see how much time and money you can save with glucose, calcium, and sodium so you can extrapolate it to your other tests, then contact clientcare at awesome-numbers.com. If you'd like to be an analyst or a panelist, or if you'd like to look at this on a larger scale for your lab chain or your company, contact me, Zoe at awesome-numbers.org. Plan to look at the next webinar if you want more detail. What do participants have to do to send risk drivers? I'm kind of interested in being a participant. Hang on a couple of days. We'll get you the next webcast. It'll tell you exactly what you need to send and where the process takes place. And where the process takes place is somewhere that you can go now, to Awesome U, where there are courses that you can enroll in. You can see more about this project, Spring into Risk Management. You can access risk management resources, and this is where participants, analysts, and panelists will gather to do their work. You can also find at Awesome U a selection of videos and newsletters from 2014 until now, with posters and glossaries and other projects and surveys. So come on over. This site is open. This project is on. The rest is up to you. We can reduce risk.